Hello, now that you got your dental implant, now it's time to talk about how you're going to take care of your mouth and how you're going to take long-term care of your implant. So I'm going to quickly go over all these instructions so that you know what to do next, okay? So first of all, we're going to talk about activity. So after leaving our office, I want you to make sure you just take it easy for first 24 hours. No lifting weights, no working in the backyard, just take it easy. Now, if you had sedation, if you had implants done while you were under sedated, then probably you are not listening to it. Maybe one of your relative is with you and he's listening to this instruction. And he needs to make sure that you are continuously supervised for first 24 hours. You are not to be let alone for 24 hours. Again, this is only for the patients who are getting treatment done under sedation. Okay. All right. So take it easy. Second is discomfort. You've just gone through a surgical procedure, so obviously there's going to be some discomfort, and we have given you some pain medication. Make sure you take those prescription as the pain medication as prescribed to take care of the pain. Okay. Third is infection. Anytime we do a surgical procedure, there is a chance of infection. And the way we can prevent that infection is we usually tend to give patient antibiotics, especially after implants. So make sure you take your antibiotic medication. Now, sometimes there are antibiotics can have some adverse reaction, so make sure you check with your pharmacist if there is any questions, or if the antibiotic that we gave you is causing any interaction with any other medications that you are taking. Okay. Swelling. So if we are doing one implant, the chances of swelling are minimal. But when we start doing multiple implants, 2, 3, 4, 5 implants, then there's going to be very good chances of swelling. Usually this swelling, it goes up to third to fourth day, and after that it gradually goes down. So I don't want you to get alarmed if you're having swelling. Now, what we need to do for swelling is for first 24 hours, I want you to use ice pack, 15 minutes on, 15 minutes off. Okay. If you don't have ice pack, you can use a frozen bag of peas. Go ahead and use it 15 minutes on, 15 minutes off. If you are getting implants done on 2 different sides, you can put 15 minutes here, 15 minutes here. The reason why you don't want to do continuously for more than 15-20 minutes is because the effect that we want ice pack to do after 15-20 minutes is actually starts reversing. Okay, so make sure it's very important. Number 1, you use ice pack for 15-20 minutes on and 15 minutes off. Number 2, you do not want to use ice pack after first 24 hours. It's only for first 24 hours. Okay. Bleeding. So it is very common to have slight bleeding for a few hours following surgery. Now, the funny thing about our mouth is a little bit of blood, when it gets mixed with a lot of saliva, it appears as if our mouth is full of blood. But the thing is, it's just a little bit of blood which is mixed with a lot of saliva. Blood is a very strong dye. Okay. Now, so number 1, you don't want to get anxious or too much scared when you have bleeding. What you really need to do is make sure that if we have given you a gauze, make sure you put the gauze right on the site of an implant. Okay, you don't want to put gauze anywhere else. Make sure you put the gauze right on the site of implant. Apply gentle pressure, not too hard. Okay. And if there is excessive bleeding, obviously I want you to give us a call. As far as oral hygiene instructions are concerned, for first 24 hours, I don't want you to brush really. I just don't want you to brush, period. If you're brushing, make sure you brush away from that side. Now, if you're having multiple implants, I don't want you to even brush. If you're having just one implant, then just go ahead and brush for first 24 hours, only the areas away from the implant, not on the implant, not on the area of the implant. Do not use water irrigation devices, water pick for for 1 month following surgery, because the wound is healing. The water pick is going to squirt a lot of water, and it's going to go ahead and cause a lot of issues in healing. Okay, so for 1 month, I don't want you to use water pick. If you have been using water pick, you want to take it a break for 1 month. Brushing, you can continue the following day. Right? Smoking. So we advise you that you do not smoke. Smoking delays healing. It is very important when you're getting implant that you know that the prognosis or how long your implant lasts depends on if you're smoking or not. The studies have shown that if you want your implant to last for a long time, do not smoke. The success rate of implant goes down, which is traditionally 98%, goes down to 85% if you are smoking. I would highly encourage not to smoke, period. However, I want you to at least do not smoke for 1 week for sure, okay? All right. Eating and drinking. So do not try to eat until all the numbing stuff has completely worn off. High protein foods and liquids are desirable for 3 to 5 days after surgery. Solid foods may be eaten as long as this may be done comfortably, okay? Eggs, custard, yogurt, pasta, steamed vegetables, casseroles and cooked cereals are some things that you might consider eating during the first few days following your surgery. Avoid spicy, salty, acidic, very hot or very cold foods or liquids. Also avoid seeds, nuts, chips or other crunchy or fibrous foods which may become caught between your teeth. It is important to refrain from drinking alcoholic beverages during the time of surgery during the days following surgery. What we also encourage you to is maybe have some kind of multivitamin that helps you with healing. Multivitamin with minerals 1 time a day. Use some vitamin C, vitamin E, or calcium 500 milligram twice a day. These all multivitamin supplements can help in healing. If you're wearing any kind of removable denture appliances, make sure when you're wearing those appliances, it is not putting any pressure or direct pressure on the implant. Try to, if you can, for first few days, you don't want to wear any partial dentures, okay? Because it's just gonna irritate the wound or irritate the place where the implants are healing, okay? So these are all the instructions that is gonna help you during the first few days of healing, okay? So if you have any questions regarding this, please make sure you ask me or one of my staff members, and they'll be glad to answer your question. Now, what I'm going to go next is I'm going to go ahead and talk to you about what to do long term, how to take good care of your implant on a long term basis. Okay, so what are follow-up instructions for long term or daily care of dental implants? So once your implants are done, they are healed, you got the crown done or you got denture done, all of that is done, then obviously you've done so much investment in your implant, so now you want to take good care of that. So the way you take good care of that is making sure you brush 2 times a day, floss once a day, use mouthwash and all that stuff. Not only that, but I want you to go ahead and make sure you see your hygienist routinely. Okay, routinely meaning for the first year, believe it or not, I would encourage you to see our hygienist at least 3 times a year. Okay, after first year, you can go back to your routine every 6 months or 2 times a year. Okay, for the first year, I want you to see at least 3 times a year. It's very important because that way, we can make sure everything is healing all right. You're taking good care of it. If there's any questions, we can answer your questions, and if there's any problems, we can identify it while it is initial. Okay. Now, the second thing is we want you to brush your implant 2 times a day. Brush that implant specifically. Now, a lot of patients are scared that, hey, they don't want to touch the implant because if they touch it, they might cause any damage. But the fact is, once the implant is healed and once you have gotten a crown on it, you want to make sure you clean it. So this instruction that I'm talking about now is instructions once the implant is completely healed, probably about a month after your procedure. Okay, so this is 1 month after your procedure. This is something that you can continue for a long time. 1 month after procedure. Okay, so 1 month after procedure, make sure you clean everything, brush your teeth, floss, see your hygienist. Now, there is something we call Prevident, or it's a fluoride gel that it is available through our office. Use it at least one time a day. Now, fluoride, it reduces the bacterial level in our mouth, and the reduced bacterial level causes less gum disease or less disease associated with bone loss around the implant. So I would encourage using fluoride gel at least once a day before you go to bed. Okay. Use dental floss as instructed. You probably, when you come to our hygienist, she'll go ahead and let you know the exact way to floss. Again, you don't want to use water pick the first month, but after first month you can go ahead and start using water pick. But anytime the water pick is used, make sure it is on the low to medium setting. You can use different tips to clean around the implant, but make sure you use low to medium speed. You don't want to use too high blast. Okay. If you have any removable dentures, sleep with it outside of your mouth at night. If you feel you routinely clench your teeth while you sleep, let us know. There is a way out for that as well. Okay. Remember that smoking tobacco has a negative effect on the longevity of the implant. Moderation is recommended, and the best thing is to stop. I think we covered all long-term care. If you have any questions, feel free to ask us in our office. Our phone number here is 916-782-3129. Thank you so much.